Hello, in this tutorial, we are going to visualize conductive cardiomyopathy. Cardiopathies, not cardiomyopathy, sorry. Cardiomyopathy is a disease, basically, of the heart myocardium. So, conductive cardiopathy or conductive cardiac pathologies. Okay, so in conductive cardiac pathology, cardiopathies, so you need to know that what in order for you to visualize the conductive cardiopathies, you must first visualize the electrical conductive system of the heart. Electrical conductive system of the heart starts from a sinusoidal node, then it goes to AV node, then it goes to a bundle of His, then it divides into the two bundle branches, left and right bundle branches to the Purkinje fibers. Is it clear? Now you need to know that what you have what is called, so generally, the sinoatrial node is not involved in the conductive cardiopathies. We are going to have sinoatrial node disorders at the level of the arrhythmias. Is it clear? So for the conductive cardiopathy, is any disorder that is associated with a reduction in the heart rate. Any heart disorder resulting to a bradycardia is going to be associated with these conductive cardiopathies. Is it clear? So it's going to be associated with the AV nodes. So you have one for the AV node. You have one for the bundle of His. Is it clear? You have one for the bundle branches. Is it clear? Bundle branches. And you have another one for the Purkinje fibers. Is it clear? The Purkinje fibers. But now, we are not going to in this tutorial, we're not going to visualize the ECG presentation of the bundle of His ECG presentation conductive disorder, and I'm also going to visualize the Purkinje fibers. We are just going to visualize the AV nodal conductive disorders on the ECG and the bundle branches disorder conductivity on the ECG. So let's start with the first one, AV nodal conductivity disorder. Generally, AV nodal conductivity disorder, when you have conductive disorders, they are generally termed blocks. When you see blocks, just know that it's a conductivity disorder at the level of the heart. Is it clear? Now, generally, you can call it a nodal block. The AV nodal disorders, they can be called nodal block, or they can be called AV nodal block, or generally they are called heart block. When you hear nodal block, AV nodal block, or heart block, they are termed to define the AV nodal conductivity disorders. Is it clear? So it means that the AV node are not conducting well the impulses from the sinoatrial node to the left and the right ventricle. So now this heart block or the AV nodal block are divided into three. Is it clear? You have a type 1 heart block, you have a type 2 heart block, and you have a type 3 heart block. Is it clear? Now in type 1 heart block, what is happening? You just have a prolonged PR interval. Is it clear? So when you measure from the beginning of the P wave to the beginning of the QRS complex, is it clear? So the beginning of the QRS complex, if there is an increase of the PR interval greater than 0.2 seconds, and 0.2 seconds correspond to 1 big square, if there is an increase of the PR interval greater than 0.2 seconds, is going to show this problem. Is it clear? The type 1 heart block. Now the second one, so it is also called, you can say type 1 heart block, or you say first degree heart block. It is clear? Is it clear? So you say type 1 heart block or first degree heart block. You have type 2 heart block or second degree heart block, or generally they are more majorly called as such, second degree heart block, and we have type 3 heart block or third degree heart block. Is it clear? Now for the type 2 heart block, the type 2 heart block or the second degree heart block is divided into two. Second degree heart block is divided into two. We have the Mobitz type 1, are you understanding? And we have the Mobitz type 2. So those are the different elements of the heart block. So the second degree heart block is divided into Mobitz type 1 and Mobitz type 2. So let's start with Mobitz type 1. So in Mobitz type 1, it is going to follow the Wachenberg pattern. Is it clear? So if you have a Wackenberg pattern, that the Mobitz type 1 is going to follow. And what do we mean by Wackenberg pattern? In this pattern, you have a prolongation of the QT interval. So let's say of the PR interval. Let's say that is a P wave. So this is the QRS complex as such. This is a T wave. Then you have another P wave prolonging to produce a QR and then a QRS complex. Then you have a T wave. Then you have another P wave prolonging again more. Then you have so you have another prolong again more. Then you have the QRS complex. Then you have a T wave, and lastly you have a P wave. You have no QRS complex. Is it clear? Then you have another P wave. So when you have a pattern where you have a prolongation, here is the one PR interval, here is another PR interval, here is another PR interval, and here is a P wave without a QRS complex. Is it clear? So when you have a prolongation of the PR interval plus a P wave without a QRS complex, that is generally called a drop beat. When you have a P wave without a QRS complex, it is called a drop beat. Is it clear? So generally term the Wackenberg pattern of the type 1, Mobitz type 1. Is it clear? First degree, second degree heart block. Is it clear? Now after that, we have also what is called the Mobitz type 2. Is it clear? For Mobitz type 2. The Mobitz type 2 is not going to follow this Wackenberg pattern. Is it clear? So in this case, you just have a PR interval prolongation. Is it clear? You have a normal, the PR interval, is it clear? There is just a prolonged PR interval. It is not a progressive prolonged PR interval as such here, where it is increasing, and then you have a drop beat. Here you have a constant prolonged PR interval. Is it clear? You have a constant prolonged PR interval, and then at one point in time you have a drop beat. Is it clear? A P wave that does not have a QRS complex. So this is a constant PR interval. The distance between here and here, this PR interval is the same as this other distance here, and then later on you are going to have a drop beat. Is it clear? That corresponds to a Mobitz type 2. Is it clear? And to visualize the conductive disorder, it is best to move still on the rhythm strip. Is it clear? The rhythm strip that corresponds to a lead 2 and the lead V1 are the best to visualize the conductive disorder. Is it clear? Even the arrhythmia disorder, all these disorders, the best lead to visualize the rhythm strip that is based on the lead 2 and lead V1. Now, the next thing after the second degree heart block corresponding of the Mobitz type 1 and Mobitz type 2, we have now the third degree heart block. Is it clear? In the third degree heart block, you have different heart rate of the atrium and the ventricle. Is it clear? The ventricle and the atrium have different heart rate. Is it clear? So what you have to do is that you have P wave, this is another P wave, then you have a QRS complex. Is it clear? Generally, you have a QRS complex, you have another P wave, you have another P wave, you have a QRS complex as such. Is it clear? So in order for you to identify a third degree heart block, generally you have to know that what? You have to know that one, the P wave, the atrial heart rate, atrium heart rate, and the ventricular heart rate are different. Is it clear? The atrium heart rate and the ventricular heart rate are different. That's the first point in the third degree heart block. And the second point in the third degree heart block is that we are going to have a malformed QRS complex. Is it clear? And the malformed QRS complex comes from the fact that the impulses that go up to the ventricles are not the impulses coming from the sinoatrial node. They are infraventricular impulses coming from the bundle of his, or from the junctions, or from the bundle branches. Is it clear? They are not coming from the sinoatrial node. So you are going to have a malformed QRS complex. So in this case, when you measure this rate, you still measure the rate by the rule of 6,300 or all those rules that I've just told you at the beginning of the session. So you measure this rate in between here, and you measure also this rate in between. You see that this rate here and this rate here, you see that the P waves are going to be more, are going to have a higher heart rate than the QRS complexes. Is it clear? So that is when you have a different heart rate between the P wave and the QRS complex, it corresponds to a third degree heart block. Is it clear? Generally, heart block have bradycardia as their pathognomonic. So from here, say thanks for your kind attention and please subscribe to our channel. Thank you.